is Arundhati Parmar. This year, we are continuing in our role as a partner of health in bringing you the very important topic of patient engagement. The Engage at Health track will feature patients, providers, retailers, healthcare startups, as well as other stakeholders keen to redefine patient engagement. This is particularly important at a moment of global peril, as we face today with the COVID-19 pandemic. The track will kick off with the story of a woman who was dealt a triple healthcare whammy. Welcome, Parul, to Engage at Health.
I was still recovering from my C-section when I was diagnosed with stage 2 breast cancer. My father suffered from severe hearing loss for over 25 years due to a misdiagnosis. And my mother faced both breast and ovarian cancer due to a genetic mutation that went undetected for over 30 years. And we're the lucky ones. My name is Parul Somani, and as the founder and CEO of Silver Linings, I combine my experiences as a healthcare executive, cancer warrior, and caregiver to represent the patient voice. I've shared my story with organizations such as the World Economic Forum, Stanford Healthcare, and the American Cancer Society. And here at Health, as we examine the current state of healthcare and look to redefine its future, I hope we keep patient voices and perspectives at the front and center of the conversation. My family has had our share of health challenges, but I consider us to be the lucky ones because we were able to navigate the system and ultimately thrive. As I reflect on the drivers of this luck, they span advocacy and access. We were empowered to be our own advocates, armed with the information and understanding needed to ask the right questions. We persisted in seeking access to specialist care who were able to provide the most tailored treatments. And we were equipped to overcome the many financial hurdles and friction that are so prevalent in the healthcare system that could have delayed our care and changed our entire prognosis. Advocacy. Being my own advocate likely saved my life. I was 38 weeks pregnant when I first felt a lump in my chest. My OBGYN assured me it was likely nothing to worry about because I was only 31 years old and pregnant, and that it was likely a clogged milk duct. 2 days later, my water broke and my newborn arrived 2 weeks early. And with complications, we needed to be ambulance transported to a neighboring hospital with an acute NICU. We had every reason to dismiss the lump, especially thinking it was a clogged milk duct. But we prioritized it, and my husband wheeled me from the NICU to the neighboring breast clinic for an ultrasound and biopsy. Even there, the breast surgeon assured us the tissue felt soft and that it was likely a clogged milk duct, nothing to worry about. But days later, on the weekend of Father's Day and my newborn's 1-week birthday, I received the call saying the mass is malignant after all. I had stage 2 triple negative breast cancer. In the year that followed, I had 10 rounds of chemotherapy, 4 surgeries, and 4 blood transfusions. But luckily, the treatment was effective. And this month, I'm celebrating my 6-year anniversary of being cancer-free. But as I reflect on that journey, there's one question that still gives me chills. What if I had not been my own advocate? It would have been so easy to believe that the lump was a clogged milk duct, and especially with the complications and chaos of a newborn at delivery, every reason to be too distracted. In fact, after my delivery and the milk came in, I actually couldn't feel the lump anymore. It would have easily validated that it was in fact due to pregnancy, and it would have been a year later after I stopped nursing that I would have felt that lump again, and my prognosis would have been entirely different. But what enabled us to have that healthy paranoia and be our advocates is that 2 years earlier, I had gotten genetic testing done, and I had learned that I carry a mutation in the BRCA1 gene, information that armed me to be my own advocate and insist on that ultrasound and biopsy. It wasn't just early detection that made the difference, though. It was also having access to a specialized care team that could offer the most effective treatments for my particular type of cancer. And this persistent pursuit of seeking specialist care applied for my father as well. For the 25 years leading up to my own cancer diagnosis, my father had suffered from progressive hearing loss, wearing headphones in his ears that would amplify the sound, but with over 95% hearing loss in both ears, it was still very difficult to carry a conversation with him and impossible to carry a phone call. Over those years, we had gotten multiple consults, but everyone had reinforced the original diagnosis and said that there was still nothing that could be done. It was only once I was diagnosed with cancer that we got access to a medical consultancy through my husband's employer to help with the research and treatment for my cancer diagnosis. I asked them a completely out of scope question, which is if they have any ENT specialists that they could recommend in the nation. And they shared with us the name of a doctor in Florida across the country that we just never would have come across who was willing to do a remote consultation. We sent our audiology reports and CT scans, and I'll never forget the day we got on the phone with him for this remote consultation. And he said, "I can't be sure until I'm in your father's ear, but I believe he's been misdiagnosed for the past 25 years. And what he actually has can be treated by a 1-hour outpatient surgery." A couple of months following my own treatment, I flew to Florida with my father for this surgery, confirming the misdiagnosis, and the doctor was able to restore hearing in my father's ears. Just a couple of months later, my father's own mother was diagnosed with cancer, and he was able to fly to India to take care of her through her treatment. And I'll never forget this text that he sent saying, "Feeling blessed, able to have lots of long conversations with mommy." Something that just never would have been possible if we had never gotten that correct diagnosis and treatment. And now in this virtual world, a man who once couldn't carry a one-on-one conversation is now able to participate in group Zoom calls celebrating special birthdays with his grandchildren. As I reflect on this story, I can't help but wonder, how could he have been repeatedly misdiagnosed? The day that we had that remote consultation and the doctor said there might actually be something that can be done, I remember feeling so filled with hope and excitement. And I looked at my father and just saw the somber look on his face. And I could just see him reflecting on how differently his life could have been the previous 25 years. But it wasn't just the access to specialists. It was also our ability to pay the out-of-pocket cost that was required for that remote consultation and the treatment that followed. And this ability to be equipped to overcome these friction points played a role in my mother's case as well. I was 6 years old when my mother was diagnosed with early onset breast cancer in her 30s. And in the 30 years that followed, not at any point was she offered genetic testing or suggested it to understand if that may be a driver of her early onset diagnosis. It was only after I got testing done and then went to work for a genomics company that I got my mom access to her own genetic test, confirming that she too carries a mutation in the BRCA1 gene. I spent the following year literally giving her PowerPoint presentations about how her risk for ovarian cancer increases over time based on this mutation, and how that risk can decrease if she were to take preventive measures like a prophylactic removal of her tubes and ovaries. It was a very difficult decision, but she ultimately agreed and flew to California for this preventive surgery, which we thought had gone successfully. It was only days later that we got the call from the surgeon saying that the biopsy of the removed organs was in, and it turns out that there was already cancer growing in the tubes. He said it was critical that we go that same day to the radiology department to get an MRI done to assess the scope of the cancer and potential spread. And that time was of the essence to ensure any follow-up surgery could be scheduled quickly. So we went to the radiology department that afternoon, ready for this MRI, only to check in and hear from the receptionist that the pre-authorization has not yet been approved. And so we would need to reschedule the appointment or sign a document accepting financial liability if it is denied. I refused to delay the appointment given how how time was of the essence, as emphasized by the surgeon. But I had also learned the hard way in the past that signing these papers can also create financial liability and burden that's least expected. And when I asked how much would it cost if the pre-authorization is declined, it would be $16,000. Miraculously, I was able to navigate that day and convince them to conduct the MRI without me having to sign that paper. And we were able to get my mom's follow-up surgery and chemotherapy treatments scheduled as soon as possible. And we were able to catch it in time while it was still at stage 1, miraculous for ovarian cancer. And her prognosis is as good as it could have ever been. But I think back about that one day, that point of friction that could have delayed her entire care. And I wonder how we have a system that forces a patient to choose between delaying their care and risking financial burden. We later found out that that pre-authorization had in fact been denied, even though she was a cancer patient in a cancer center getting an MRI required by her own oncology surgeon. The pre-authorization had been denied, and had we signed that paper, we would have owed $16,000. As I think about the future of healthcare, my aspirations for it are very simple. That I want a better future for my daughters and the many families and communities that are not as lucky as we are. Specifically, I want us to all be empowered to be our own advocates before we even become patients. I want access to specialist care to not be restricted to the lucky few who happen to be able to overcome financial or geographic and logistical hurdles. And I want a system where families aren't forced to choose between physical and financial health. I hope by keeping these concepts of advocacy and access at the forefront, we will be able to create a better future for healthcare. We have to do better. Thank you.
Wow, Parul, I don't even know where to begin. Listening to your story reminded me of my own sort of experience navigating healthcare for my brother who died of cancer a few years ago. After he died, we got a call from the ambulance company who told us that we owed them $6,000 because when we dialed 911, the ambulance that was sent was not in our insurer's network. To this day, I still don't know how in a 911 call I am supposed to ensure that the 911 caller sends me a ambulance company within the insurance network. Thankfully, we didn't have to pay for it. His employer very graciously took care of all the problems. Anyway, so I wanted to start there. The incredible frustration that patients feel in dealing with insurance companies. Now, there are all kinds of policy ideas being thrown about now that we're in an election year. But let's for a moment assume that we will have the current system that we do have. What can be done to alleviate these anxieties that patients have? Any suggestions for payers or for patients that you may have?
I think in our current system, the greatest way to ease the financial anxiety is to have more transparency into what the costs will be and having streamlined billing to facilitate it. I think healthcare is one of the few, if not only, industries where the customer is expected to pay for a product or service before actually even knowing how much it will cost them at the end. Earlier this year, happened to go to India to help manage the cancer care for my aunt. And it was very eye-opening to see how healthcare is dealt in India. And it was almost an e-commerce experience where she was asked to get an MRI. And you don't just go to the hospital, get an MRI and find the bill later. We actually went on the internet, shopped at different labs for an MRI, like MRI with contrast or without, added it to our cart and checked out, paying upfront out of pocket for this MRI, and then took the receipt to a lab to then get the services conducted. And there's obviously a very different system in India where more of it is out of pocket, but that level of transparency and just clear understanding of how much is going to come out of pocket before the service is conducted was very refreshing and something that can be learned from our system here.
So let's talk a little bit about patient empowerment. And you talked about the transparency element, but you were fortunate in the fact that you're so sophisticated, you were able to navigate all these different friction points, as you called it. But what about people that either don't have the time or the wherewithal to deal with such a complicated system that we have? Do you have any suggestions for payers to make these people's lives easier? I mean, I know payers and providers are trying to bring people that have different language skills. Sometimes they work with community workers that have similar life experiences. But what else can be done by payers and by providers to really remove this anxiety that people that are patients are already feeling about their health?
Yeah, I think beyond just having people that are speaking with patients in a different language, I think it's important to actually change the conversation itself. And that is by emphasizing the importance of a healthcare system actually being to keep people healthy and not just after they become sick. And having the conversation be what type of information, what type of data points, what type of understanding do patients need to actually stay healthy, to actually focus on prevention. Only 3% of healthcare costs today even focus on prevention. And empowering patients with information that will help them earlier on will actually change the entire dynamic for how involved they will be in managing their own care and the burden that is later placed on payers and providers to manage that care as well.
I think the other takeaway from your presentation is the importance of genetic testing. And, that has been gaining steam, but we hear so many stories of providers, prescribing genetic tests and then payers coming and saying, oh, we're not going to cover that because it is not clinically necessary. So I think that paradigm really, really needs to shift as well. I was also fascinated by the story of your dad's illness. Can you give me any sense of why the providers kept making the same misdiagnosis over and over?
So we don't have any firm answers, but what I took away from that experience is that there is a severe risk of confirmation bias when it comes to getting multiple opinions. I think in these cases, because we had shared the previous files, we had shared the previous diagnosis, there was this element of assuming the original diagnosis was correct or reinforcing the original diagnosis, but then simply saying that from a treatment standpoint, there's still nothing that can be done about that particular treatment. And what I've learned from that is going forward, anytime you're seeking a second or third opinion, go into that conversation with a blank slate and have the assessments and diagnosis be done by scratch rather than potentially be biased by any previous opinion.
So now my final question to you, Parul. You have been a patient, you have been a caregiver, you've been an advocate. What does patient engagement actually mean to you?
Patient engagement to me means different things at different stages. I think earlier on in the timeline, it has to do with prevention and education to a patient to make sure they understand the steps that they can be taking to stay healthy. It means engaging with the client or with the patient and their families to provide holistic support. And that means coordinating care across the many parties that are involved when someone is ultimately diagnosed or being treated with any particular condition, and ensuring that it's not just the physical body that's being treated, but the mind and soul of that entire patient as well.
Well, thank you so much, Parul, for taking the time with us today and sharing your really, really compelling story. Good luck to your parents as well. Thank you very much to everyone watching.
Thank you.